Hi, I'm Dr. Bruce Rippey. Welcome to Bridge Integrative Medicine. This is Deryck. This is your first time with me today, isn't it?
It is.
By the way, occasionally I look in a mirror. There's a mirror right there. You want to show them the mirror there? Yeah. See, and so this is how I view their eyes looking back at me. It's also how I get the great expressions when you squeeze on something that's not working right.
Right.
Like this. So, what brings you in today? Let's just go through that.
Upper back and neck pain. Not quite sure what it's associated to, but I am having a lack of sleep. It's been a kind of a cumulative thing over the last 2-3 months. Some nights are worse. Sometimes, I'm trying to stretch at home, but I definitely been feeling range of motion has been drastically restricted over the last couple months, and so I'm really flexible in general. So it's just
I noticed
not
that. We've talked before, obviously, and we've got your history. So usually athlete, strong, no problems. All of a sudden, anyway, the last couple of months we've had a problem. So tell me the story then. Was there an event?
No, I do remember not sleeping well one night, waking up and just feeling like I had a pinched neck, but it never went away.
Oh.
So like very limited range of motion going this direction.
Right, rotation.
40-50% going this direction. Figured, let me stretch, give it a couple days, whatever kink, it'll work itself out. It never really worked itself out.
Okay. Okay.
I mean, it's better in general,
Right.
not as extreme as it was before,
Right.
but the pain was morning through evening. I mean, it wasn't like peaks or waves. It was, I can't move past this point, and it's staying right here.
Okay.
So, of course, I'm like using a ball or trying to
move
help.
yourself.
Yeah, trying to work out the knots or whatever, but just not getting it.
I know, that's what you should do, right? Try it yourself. See if it works, right? If it doesn't, you come see me.
Right.
Right. Okay. So that's really actually good. And by the way, I want to compliment you on your haircut. It's very good. I'm working on that myself. I really like this haircut. Very well done. So the way we check that is first you're going to ask a bunch of questions. We've kind of asked a bunch of those, right? Did anything make it better?
Other than just pushing on the muscular pressure points to try and relieve some of the pinching and cramping type sensations. But other than that, not really.
Have you tried any over-the-counter meds or anything like that?
I did try some ibuprofen a couple times when I was starting to get some migraine or like splitting headaches after a few days of just the pain being chronic, and I could tell like my whole body was just getting tight, and going this direction. I was trying to really stretch my cavity to get, I normally have a really good posture, but I could tell just over time I'm doing this. So I did have some, probably a couple times a week, some ibuprofen to try and lower some of the inflammation and whatnot. Yeah.
That's really good. And then sleep is the main thing that you found as far as organ system go that has been there.
Lacking.
It's important to note that I do have all of the data on record, everything that he has told me. It's important to note that. So these are just questions that I would ask anyone as an update or perhaps as an adjunct to our normal line of questioning that he's already written out. You've already filled out all your stuff. So let's test some things. When the nerves come out of here, they go down the neck and they go out the arms and shoulders.
Okay.
So let's test some stuff. First thing we'll do is we'll do this bilaterally, but let's first of all get a little squeezing contest going on there. I know you have a great grip. We're friends, so I know you've got this thing, but go ahead and take a real hard squeeze at that. And that is excellent. Have you noticed any weakness in that hand?
No, but this hand.
That's the question, okay? So the same thing, let's get a good grip first so we don't hurt each other, and then go ahead and go for it there. And it's really pretty close to the other side. I do have a dynamometer that will check that if we need to, okay? But I didn't notice that one being much less than the other side. And normally if there's a marked weakness, that's where the danger lies.
Okay.
But a great big hand like that, each one of these is a different one. You're going to spread the hand out as wide as you can.
Okay.
And I'm going to try to squeeze these fingers together. Don't let me.
Okay.
Ready? Go. Really fight. You did great, actually. Not a lot going on in there.
Okay.
Same thing. Big wide hand. Really fight there. Those are excellent. Great tension. Let's try the thumbs. You kind of pull them back towards your wrists really good. That's excellent. We'll fight here. No, there's nothing going on in there. Those are really good. And then if I have you stand up one last time and just kind of turn this way so the camera can see it, I'm going to ask you to push down and use, obviously, the triceps in the back. And go ahead and just push. You're a very strong dude. I don't think that's going to be a problem, okay? It's not showing up as weakness. Tell me about it when you notice it as a weakness. What are you doing when it's weak?
In my arm, now I know that this is going to come from a previous injury that I really don't know the gravity of damage done, but I have noticed, sometimes it's triggered by something totally off, like making a bed or lifting weights. So not necessarily anything consistent.
Okay.
But it was trauma in my joint somehow. Like, I don't know if it was a tendon wrapping this direction or what, but I actually feel the pain in my tricep.
Huh. Well, the tricep is actually fairly strong, though, isn't it? Go ahead and make a grip.
Yes, it is, and it's not all the time.
And push down again.
And it's not all the time,
really
but it'll almost feel like it's constricting, and it's pretty
Oh.
severe.
Oh.
But in terms of what, like all the pain through here, I don't know if there's anything other than it just kind of comes in waves. Worse, obviously, in the morning.
Okay.
Depending on what's going on the day,
Right.
maybe worse if I like
Right.
whatever it is that I'm doing, or even just sitting. Like if I'm at the desk, a lot of desk work, you know, I can just feel it. And normally, you know, getting up, doing a couple push-ups, doing some stretching in the middle of the day, like takes that away. But of course, right now I'm not really getting the relief that I normally would have. So
okay. All right. Well, go ahead and sit back down. Let's go ahead and go through the range of motion of what your neck actually does.
Okay.
What we like about it, and what we don't like. So basically, functionally, when we go through the efferent nerves, they're actually quite good. Now, afferent's going to be more of your sensation, pain, hot, cold. Efferent's going to be, can I use that? And you can use that actually very well. Your arms and hands are quite strong. So let's see what we can do as far as this goes. It's tight at the end. There should be a spongy end feel to everybody's neck. There actually is on that side, but there wasn't on the left. It felt like it got to a closed door, and actually it felt quite closed. Mm-hmm. We'll do rotation just carefully. I don't want to overdo. Then we'll do this. Yeah. Let's have you look up towards the ceiling. There's a little catch there, and then it kind of goes the rest of the way. Try again. Just go back to neutral one more time. Come all the way back up. Yeah, and go back to neutral there. It does seem like you're trying to fight around something right there. How about the trigger points through there? Have you been noticing pain across this? This is the trapezius, upper division. Is there anything?
Not like a pinching or a hypersensitive point.
Okay. Yeah, I'm not noticing that really either. I'll put a little pressure down very gently at first. I just kind of want to see how that loads on your neck. Any pain when I do that?
No.
Okay, we're going to do a little bit more just to see. Just enough to kind of put some pressure on that and have that move there. Any pain?
No.
Okay, all right. So there's 3 answers to this question. I'm actually going to decompress. Let's do it slowly, right?
Okay.
Just add a little bit to it. Give me, I don't know, 8 seconds. It won't take me that long, but we'll just kind of do that nice and slow. Mm-hmm. Then there's 3 answers to that question. That felt better, that felt no change at all, and that felt worse. Okay? And just be at peace there, because I really do lift carefully here. Breathe into that just.
Almost instantaneously, within the first 2 millimeters of movement, I like chills, like relief, instant relief, all the way through the stretch.
Yeah, so that actually felt better.
Yeah.
Yeah. So not uncommon, okay? This is one of those things that's more chronic than it is acute. If there's no injury there, we're not looking for fracture dislocation, obviously, okay? You would have had an event. There's no event. Mm-hmm. I know you, so I know that you know that well. Otherwise, we would be getting an x-ray right now, and we would be seeing what's going on in there. Here's the other good news. Great curve, no humping, no lift anywhere. I'm not palpating anything weird. There's no edema. So I'm feeling very safe on changing this. Any dizziness? Do you ever get, is there a dizzy factor to it?
Not unless I've been sitting for a long period of time and I get up too quickly. You know, like the normal head rush type of thing. Outside of that, no.
How's the headache?
They're infrequent and bizarre. So sometimes they'll be frontal, sometimes they'll just be like creeping. I can feel it loading from the back and moving forward if I'm too tight or whatever. So on average, I don't know, 2 to 5 times a week, depending on what's going on, at least over the last, and normally maybe a headache a month, maybe.
Okay.
So like, it's not like something I have regularly. If I do have a headache, it's really extreme, like a mild migraine. It might be, you know, once a month, once every couple months. if that ever happens, but definitely 3 to 4 times a week, which is not normal.
Well, it's important to note that all headaches are neurovascular. So you can call them a migraine generally if they have a prodromal phase. Do you get anything like that? Do you get the flashes across the eyes, weird smells, sounds that people aren't really there? But
I've been experiencing a little bit of like stars.
Stars.
And if anything, it's just, when it loads and it kind of totally comes forward to the front, having a hard time just keeping my eyes open, just feeling the pain almost coming through the back of the eyes.
So what you described almost perfectly is myogenic cephalgia, but it can also show up as a cluster headache, and that's easiest understood as a headache on top of a headache. There's a problem, something neurovascular, and then there's another one, right? So you wind up stacking those, and they can be, pain-wise, that's a difficult one. Migraines are generally very painful, but we've also got patients here that have migraines that have no pain at all. They simply see the lightning flashes, or they'll smell something, and I don't have any pain, I just have the prodromal phase of the migraine. That's usually myogenic cephalgia, or what's called a cluster headache, if it becomes horribly painful. I feel really safe to be able to adjust you. It's important to note that we've already talked before about all this kind of stuff, and I think you're going to dig it. I know you do. All of my athletes love me. They do. You don't have a choice, right? That's why when Rafa Nadal wins, he says, thanks to my physio, thanks to my chiro, thanks to my entire box, right? I mean, that's what keeps it going. And so let's go ahead.